Hello, I am Dr. Krishan from Teaching Hospital Badulla, Sri Lanka. So these days we find a lot of patients are coming with sexually transmitted disease, as well as lot of social problems and lot of psychiatric problems. So if you analyze those type of problems, we find that these are due to some sexual abnormalities. They are getting these types of problems. So today I wish to elaborate what is happening in our social life, family life, as well as sexual life. So this program intention is to identify the problem of each and every individual, and after identifying that problem, he has to get the help from a doctor or a family physician, and after that he can solve the problem. So I remember one of my professor's word. So if you ask 3 types of questions, if that 3 types of questions he will give a good answer, a positive answer, 95% of that patient is not having any problem. What are the 3 questions? As short we can tell: food, sleep and sex. The patient is having a diet very well and his appetite also very good, and he can take meals regularly without any hesitation, so he is alright. Second one, he can sleep nicely in the night, so almost 6 to 8 hours per night he can sleep without early morning wakening. His condition is perfect. Third one is sex. He is having a very nice sexual activities, as well as very nice sexual relationship with his wife or with his girlfriend or with his boyfriend or with a husband. All 3 categories are fulfilled. 95% of the patients are clinically as well as other aspect physically is alright. So from this we can find the sexual health is very, very important. In our country we neglect entirely a sexual health. Even when the girl attend menarche, so we usually tell that if the girl get the first menstruation, first of her periods, I know and I heard some people came and got my consultation. They run around the houses and seeing that blood on her underwear and on her legs, and she is running around the house and she find very difficult to cope. So this is in our country the pathetic condition of our sexual health. Even if you go to the university, or even if you go to the technical colleges or non-vocational training centers, if you start telling them or training them how to wear a condom, so how to remove a condom, how to throw a condom, they start smiling. So these type of thing is common in our country. So sexual health is very, very essential. I am almost doing this type of programs for a long time, almost 12 to 14 years I am doing. So what is the sexual health? Very, very important, and we must know the criteria of the sexual health and what are the things we have to maintain in a normal sexual life. So normally in our country, normally the marriage age, when a girl or boy getting married, that age is around 21 years. You must ask why this age is around 21 years. You know, in our brain there are several parts of the brain. There is a frontal lobe, there is a parietal lobe, there is a temporal lobe, there is an occipital lobe. There are several parts in our brain. For our behavior, there is an important part in the brain, that is our frontal lobe. Frontal lobe means the part which is in front of the brain, that is called the frontal lobe. So I am a doctor. Tomorrow I can wear a shorts and just a t-shirt, and I can't go to the hospital because the frontal lobe tells me Now you are a doctor, you have to wear decently and properly to your working place, then only you can go to that place. That's a warning sign sent by the frontal lobe. So for humans, the entire human character, the behavior is entirely depends on the frontal lobe. So when the girl is having a love affair with a boy, when the boy is having a love affair with a girl, when the frontal lobe is not developed, they don't see anything, just for the sexual attraction they are going to go. Just for the sexual attraction. But when the frontal lobe is entirely developed, the frontal lobe gives us a signal to the girl to check that man is a proper man, a good man, decent man, without having any bad habit, you can marry. Like that for the boy, the frontal lobes give the signal that this girl is a good, she is having a very good character, she is an educated girl, she is fit for me as a wife. So these type of signals coming from frontal lobe. So when the boy and a girl or male or female going to get married, the frontal lobe must be fully developed to give a signal to that proper behavior. So that first question is, when this frontal lobe is going to mature fully? That at the age of 20 to 21 years. So from that we can gain a knowledge that a man or a woman or a male or a boy or a girl, when she gets the age of 20 or 21 years, then only she is fit to get married. That's the most important thing. Then after marriage, we are having sexual relationship with our wife or with our husband. That's the most important thing. You can ask, so in our country we normally go for programs and ask why we are getting married. So normally, as frankly we can tell, we have to get married. Why we are getting married? To get a sex from a boy or from a girl. So for a sex only, 100%, the purpose of marriage is the sex. So nobody will argue with me. Some will tell, I want to increase my population. So somebody will tell, I want to increase my family people. No. First one, for a marriage, very, very important thing is coming is sex. So now I can finish it. So if you like this program, share to other people, like this program, as well as introduce to your friends. And when the people are seeing in the YouTube, just subscribe, pressing on the bell sign. As well as when you are seeing in the TikTok, definitely follow me in the TikTok. Thank you very much.